I've warned for months how the UN, World Health Organization, and the World Economic Forum may soon be pushing for a world digital ID and a digital currency. Moving possibly closer to those things, Nebraska has become the first state in the U.S. to create a state health information technology board to collect health information on all Nebraskans in a centralized data and surveillance system. The 17 members will oversee the collection of patient health records and histories, physicals, discharge summaries, immunization records, radiology, medication history, family history, and other health personal information. The Nebraska legislature in 2020 voted unanimously to create the HIT board. The board members include doctors, a nurse practitioner, hospital administrators, and other healthcare stakeholders with experience in making informed decisions about the health data that they help govern. The state law that created the HIT board designated the Nebraska Health Information Initiative as the state's health exchange to manage the data of more than 5 million patients to centralize and administer the information on Nebraska's health exchange. Sync Health says its mission is to create a comprehensive health record for every Nebraskan that will be instantly accessible to patients, doctors, nurse practitioners, radiologists, and other health professionals. They say at the patient level, when providers aren't able to communicate, mistakes happen, costs rise, and patients suffer. Sync Health also said, that's why we're breaking down barriers to deliver the right information at the point of care every time. The centralized data will enable public health and hospital administrators to analyze trends in utilization, determine appropriate care management strategies, enable effective review to detect fraud, waste, and abuse, and more effectively direct funding to high-value care initiatives. There are many health professionals concerned about the direction that's being taken by Nebraska. Stacy Skoll, a board member of the Children's Health Defense Nebraska chapter, says she and other chapter members are troubled by the sudden centralization of Nebraska's health data that occurred since the pandemic. My biggest concern is what's happening in Nebraska. If you connect the dots, we've laid the groundwork for digital IDs and CBDCs, and that's alarming. Many believe that any digital ID that eventually comes along will be ripe for theft of sensitive private information. The Population Health Information Act paved the way for the creation of the HIT board and designated the Nebraska Health Information Initiative as the state's health exchange. In 2021, Nebraska passed Legislative Bill 411, requiring universal participation in the Sync Health statewide information exchange. Nearly every health facility in the state has complied, except in cases where a facility lacked the digital or financial resources to hook into the statewide system and received a waiver for the time being. Sync Health is based in Omaha and is a member of the Nebraska Health Information Initiative of the Caron Alliance. Caron is a global multi-sector nonprofit with giant healthcare and digital organization members like Google, Microsoft, Amazon, Cigna, CVS Health, and ARP. The organization is pledged to developing global digital ID credentials, along with the Vaccine Credentials Initiative, the World Health Organization, and the World Economic Forum. Greg Glazer, a California vaccine rights attorney and digital privacy expert, says Nebraskans are right to be concerned with the rapid centralization and control of the state's health data by the state and federal government. Glazer said all of this is a push to ultimately give everyone a smart health card. Smart health cards are vaccine passports designed to integrate flawlessly with any future global digital ID, Glazer says. Vaccine passports are the smaller road that connects to the larger highway of digital ID. Digital IDs are being marketed as a useful tool of consumer convenience, not the unprecedented control they could usher in. They're also falsely presented as government issues. Digital IDs will also bring in a digital ID wallet that will allow the implementation of CBDC, a digital currency. Governments could then have total control over consumer spending habits. This is H.A. Graves.